There's 3 stages of pre-reg. Starts with stage 1, then stage 2 and the OSCEs. At this moment I'm preparing for my OSCEs, and so I finished stage 2, and so it's the last few weeks left of pre-reg, yeah. Stage 1 consists of 3 visits, and a 4th one may be required for some pre-regs as well. Stage 1 is more of the basics of optometry, so how you do your pupil reactions, how you dispense, forming a baseline of the whole sort of career you're going to go through. So you have certain groups of competencies, and for those competencies you have to show a patient record. For example, a patient requiring applanation tonometry. Then they look at you performing the technique and the theory behind it as well. So it's split into 3 parts. I felt like from uni to stage 1 there was a huge jump in what my knowledge was. You're also almost learning all of your university course again as you go through. I found the first sort of 3 months quite difficult, so because you're still trying to find the baseline of what's going around store, and you're trying to find the patients, you're trying to think, am I doing this correctly, am I doing that correctly? I think I went really slow, so 2.5 hour testing in the first month, and then reducing that down to 40 minutes, half an hour now. Time management and diary management was quite a challenge, so managing your own diary, knowing what patient's going to come through the door. So some patients, like for example, required a patient with a colour vision defect. You're not going to know who's booked in with what until they're actually sitting on your chair. So it's being quick enough to grab that patient before another optometrist takes it through. The first 2 visits were quite nerve-wracking, and then you get used to the process of having someone there in your room. My supervisor helped me quite a lot in that. The first 4 months, he'd be in most of my eye tests just for me to get used to someone being there. When stage 1 was completed, I felt really good, but then I also knew at the same time that it was going to be repeated, the whole stage 1 in 6-week window, rather than almost 6 to 7 months. Stage 2 is a routine eye test on a presbyopic patient, a contact lens fit in one eye and a contact lens aftercare in the other, and also going through patient records for certain competencies. So it's 95 elements of competence between stage 1 and 2. Initially I was like, okay, how am I going to do this? But then when you look and read through exactly what's required, it's what you've done already, and it's sort of going through the notes again and again to make sure that you know it for the assessment. But you have to stay calm in that process to be able to sort of answer the questions at the stage 2 assessment. You do feel nervous when you have a visit, so that's normal, just to control those nerves, because they're looking at how confident you are with the patient. Because if you're nervous when a patient's in your chair in a real eye test, it's not going to be what you want. OSCEs are objective structured clinical examinations, so it's 16 to 17 stations, including a 5-minute rest station, and it goes through general clinical scenarios that you have in day-to-day practice and how you would manage that in a window of 5 minutes. So it's mainly conquering your communication and how you would sort of make the patient understand, how you'd make the assessor understand what you're trying to say, and sort of in a pressure situation, how you'd handle that. In those stations, it might not be just one skill, so it might be interpretation, communication, slit lamp technique, and other few skills in that 5-minute window. I don't know how to start preparing. I'm going to try and go through all the competencies and perhaps revising small groups with other colleagues, and also getting my supervisor to give me a scenario randomly. How would I handle that situation? I think preparation is key, and being organised from sort of day 1, reading through sort of the pre-reg guide that we've got, reading through all the competencies and what they require. So you know in week 1 when you start, say there was a patient that you see that's very rare, that you do go and grab that patient. Be proactive and be ready to sort of make mistakes as well, because that will happen in the whole year. I've really enjoyed the pre-reg journey. Learning from everyone, your patients, supervisors, staff members, and just building on some of the foundation that you've learnt at university, and how that's sort of shaping you as a clinician now. And it's good to sort of see the journey.